Hello, welcome to the Big Africa podcast. I'm very happy to have someone today, a doctor, Dr. Kuaban Alain, a pulmonologist. That's a very big term. I think it really it's difficult for me to pronounce a little bit, and I can imagine how difficult it will be for other people too. But I think it's a really important field of study. And when I was thinking of who to talk to next, I could think of no one else but Dr. Kuaban. Very happy to have you here today.
Thank you for having me, and it's a pleasure for me to be in the Big Africa podcast, and really an honor for me.
Thank you for saying that. Pulmonologist. It's a big word, obviously, but I'm sure what you do is pretty simple. It's something that you can explain to the average person and they get to understand. So, what exactly is it that a pulmonologist does on a day-to-day? What do you do every day?
Pulmonology, it's a medical specialty, so it's a specialty that has nothing to do with surgery. It's a specialty whereby doctors diagnose and treat conditions that have to deal with the lungs. So it's a specialty that deals with the respiratory system, specifically the lungs. So we just put it that way, that anything that has to do with the lungs that are sick, a pulmonologist will handle, as long as it is non-surgical.
Okay. So basically, we can instead of saying pulmonologist, we can just say lung doctor.
Yeah, simply that.
Lung doctor, yeah. And of course, the lungs are very, very important organism, and they have so much of a part to play in terms of health and everything else. So, as a respiratory specialist, what are some things that people do every day that they don't think about that really puts their health at risk?
The most common thing that people do, and I think they know that it puts their health at risk, but they say, we'll deal with it, is tobacco consumption, tobacco smoking. Because the problem with tobacco smoking is not only for the person who is consuming the tobacco, it's also for his environment. Because the people who are around him are what we term as secondary smokers. Whereas the person who is the active smoker is consuming the toxic substances and also passing on some of those toxic substances to his environment. And that is something that can be prevented, because you can avoid consuming tobacco, and you can avoid several diseases that come with it.
Yeah. And as you said, people actually know, because the cigarettes of today, on the packet, they write it, this is bad for your health, and people still buy. Sometimes I think, how is that even possible? It's written right on the packet that this is bad for your health, but you still go ahead and you still buy it.
Yeah, that's because there's an aspect of addiction into it, because in the concept, or in the construct of manufactured cigarettes, you have nicotine, and which is a strong substance that can cause addiction. So you see someone, he says, I want to stop. But when he says, I want to stop, there's still that drive to want to go and take not just one stick. But when he takes the one stick, he's like, and then he wants to the next and the next. And that's why you see someone who consumes tobacco, the first time is always once in a while. Then progressively, as time passes, he starts taking more. That's one. So people actually know, but they find it difficult stopping themselves from consuming the tobacco. That's one. Secondly, consuming tobacco is less costly on a go. A packet of cigarettes, 1,000 francs, some 500, 600 francs. So it's readily affordable. And the last thing with it is that consuming tobacco with the younger generation is ascribed to being a man, being tough. So I'm able to smoke heavy. So people take it as something which is cool, and as a result, they find themselves into that.
Yeah. Very, very sad for sure, especially on the addiction part that you can get addicted to that, and keep taking, even with all the warning signs that everyone says. But I think in terms of taking in substances, the new kid on the block is really the one commonly known as Shisha, which I'm sure you know all too well. That's something that people, especially younger people, they think it's cool. They take, but that compared to cigarettes, how bad is that?
Well, the new kid on the block, which is Shisha or hookah, as it's known in other environments, is quite bad because you're being played with. You think it's not something which is harmful because there are the fruit flavors that are put in it, but the basic concept is that hookah is still some form of tobacco smoking. So it's still a form of tobacco smoking, but this time with some sort of camouflage because of the fruit flavors that are in it. And as such, what happens is you consume tobacco constituents without knowing that you're consuming tobacco constituents. And the problem with Shisha is that, according to some studies, one inhalation of Shisha contains 15 times the amount of carbon monoxide found in its manufactured cigarettes. And some studies or some people have come to studies and said one inhalation of Shisha is the equivalent of 7 cigarettes. Some people say 15. But all in all, it shows that consumption of Shisha is still some form of tobacco smoking, and it also has nicotine in it. So the addiction phase is still in it, and you find yourself taking more and more toxic substances without knowing because of that fruit flavor, which is masking things on the background.
Yeah, wow, very, very, very difficult. I think that blend of people who want to be in with the cool crowd and taking some of these substances which you think it's pleasurable, it's all of this, but at the same time really doing a lot of damage to your health. I think it's really a difficult situation. And I know that not too long ago the government of Cameroon actually banned the sale of Shisha. I don't know how effective the enforcement of that is going, but I think that was a step in the right direction.
Yeah, I think it was a step in the right direction. And the difficulty with control, the difficulty has to do with enforcing it. And as of now, I don't know what policies have been put in place to be able to make sure that law is passed into real enforcement. But I think it's a step in the right direction. And another problem which those habits, tobacco smoking and Shisha smoking, is that people find themselves in environments where you're consuming tobacco and you're consuming alcohol. And it's a deadly combination because that combination, I remember in my medical training days, each time there was a lecture on a chronic or severe condition, you would hear risk factors for the problem: tobacco, alcohol consumption. Tobacco, alcohol consumption.
Yeah.
Kidney problems, you see it. Respiratory problems, you see it. Cardiovascular problems, you see it. Digestive system problems, you see it. So nervous system problems, you see. So practically, many conditions are preventable if you do avoidance of those two substances.
Yeah. Yeah, as they say as we say in Cameroon, it's always what you love that kills you. Yeah. Basically,
well, we always say something must kill a man.
Yeah, and we're a society of people that really like the alcohol. But I think that control basically is really, really important. If you're health conscious, if you want to make sure that you have that longevity for yourself, for your family, and all of that.
Not to cut you short, drinking alcohol is not a bad thing per se because it has some benefits, but it's the abuse of it, the excess of it, that is problematic. Because they say 1 pint of alcohol a day at meals is not a problem, which is equivalent of what we have as a beer of 5% alcohol content, a beer of 5%, bottle of beer in Cameroon won't kill, but is consuming it on a regular basis and consuming it in large quantities that is the problem.
Yeah.
But then some people would now think, okay, he says on a regular basis, so I'll say on weekends I consume and I can kill myself on weekends, and during the week I'm working, so I'm not doing regular consumption. No, that's still a problem, because there's what we call binge drinking. And binge drinking is a problem, meaning you consume large amounts of alcohol in a short space of time, but that consumption is still problematic because it's still ascribed to health-related problems.
Yeah. Beyond alcohol, there's a lot of, like I joked earlier, we are a society of heavy alcohol drinkers. So I think we need a mass campaign. We need a mass campaign of people saying, hey, how do we get better at managing these aspects of our health? But beyond just alcohol, there are definitely other things like pneumonia, which I think is a big part of your specialty, and which around the world is a big risk factor for children. It causes the death of many children around the world. But in Cameroon, I think it's around 18% of the deaths of people below 5 years old. Looking at those stats is very scary, but I know as an expert in it, what is the real cause of this, and why is it so harmful to children?
Thank you for the question. The first thing is that we need to deconstruct what is known. The knowledge of parents traditionally is pneumonia means you are associated with being exposed to cold weather, whereas that's not the problem. The problem actually is that pneumonia is an infection, and the infection is an infection of the lungs. That's pneumonia, as we call it, means infection of the lungs. And that infection can be caused by a virus, it can be caused by a bacteria. To say, why do we notice pneumonia in the cold periods? Is usually in the transitional periods whereby there are viral infections that are very prevalent. And those viral infections come and weaken your immune system, favoring bacteria now to come and superimpose on them. There's a superimposed bacterial infection. And so that deconstruct of what is known around the block is something which is quite important. But now, the pneumonia, why does it affect the young children? Or it's not only the young children that pneumonia affects. Pneumonia affects everybody who has a fragile immune system. And that fragile immune system can be under 5, children under 5, their immune system is not yet well developed. People who are elderly can easily have pneumonia. Like if you look well in checking, you would discover that Nelson Mandela himself, for example, had been admitted in hospital for pneumonia at some point in time. So, and it's very deadly in those ages. You would see in younger people, that's the young adult, is people who have comorbid conditions. So those things make pneumonia to be prevalent and to be easily deadly. It's people with comorbid conditions like HIV condition, which is not treated, diabetes, which is not controlled, kidney, liver, lung problems. All those things favor the occurrence of pneumonia. So anything that can decrease your immune system, anything that can make you to be exposed. And another thing is that some of those so-called good life habits, where you say, okay, I'm always in an air-conditioned room, but you're in an air-conditioned room with the air conditioner which is not maintained on a regular basis, not checked and cleaned on a regular basis, that air conditioner can keep germs which you can inhale, because the major way by which you have pneumonia is usually by inhalation route. And some of those germs are are there because the lungs are supposed to be a sterile environment. Your body has mechanisms to make sure they are a sterile environment, but you can have germs which find themselves entering into it, and when they enter, they will cause trouble.
That's that's very scary. Looking at that from that all the things we look at, like for example, an air conditioning unit can be a source of bacteria which can make us sick, which can make our children sick. I think the prevention per se is really something to take very, very seriously. And moving a little bit beyond some of your specialty, you talked earlier about high blood pressure, which is also a risk factor to some of these respiratory conditions. And across Cameroon, and as you may know, a recent study by the Ministry of Public Health found that 29% of Cameroonians are dealing with hypertension, high blood pressure issues, and all of that, and only 14% of those people are actually aware that this is going on. And so you see that it's a very big problem that people are not talking a lot about, and people don't understand that this is what's going on. What do you think are some of the underlying causes of this really big problem across the country?
Hypertension, first of all, is not just a problem that respiratory physicians will see. Every doctor, there's a saying that hypertension is a disease of every doctor. That's every doctor should be able to diagnose and manage hypertension, not just cardiologists, not just kidney specialists, but every medical doctor. And why are we having more and more hypertension in our environment? The first thing is the change in habits. For our grandparents, and so they were used to getting up in the morning, going to the farm or going to hunt, meaning you are physically active. You are always active. Compared to now, we're in westernized society where you get up in the morning, you get into a car, go and sit in an office and work the whole day. And then even the way our foods are made, back in the day, it was traditional, like really fresh from the farm. But nowadays we have the canned foods, the seasoned foods, the salted foods, and all the hamburgers and all the rest, which we take as is good. That's good living, but we forget that we are consuming a lot of salt. We are consuming a lot of fatty tissue, which is not good for the body. So the reasons why we have a lot of that is because we are changing cultures. We are adopting more and more of the westernized and failing to keep the African traditional aspects, which could prevent some of those things from happening. Yeah. So that is what we can say with regards to why. And again, people don't have the tendency to go to hospital. Like, let me just go and get myself checked. Here in our country, Cameroon, people tend to go to hospital when they have a problem. It's like, oh, my tooth is aching. That's when you see the dentist. Oh, I'm feeling some pain. That's when, but you don't go, you're feeling well, why should I go to hospital? Okay, we're in an environment where people, like really the transition to the westernized aspects, people don't tend to go to hospital. We have the tendency of, oh, I'm having a pain. That's when I go to hospital. And at times, even when you have the pain or you have the fever, you first start by, let me try that vendor on the street who is having some tablets or so, or let me go to the pharmacy rather than going to hospital. And so some people don't have the tendency to check their blood pressures. And that makes people to arrive in hospital or are diagnosed for hypertension when they are already having complications. So that's why the statistics are scary, and we have that in our environment.
Yeah. Beyond I think beyond just the diet and the lifestyle changes and the fact that we've moved away from a much more active lifestyle to more sedentary, where we're sitting all day. What do you think also about the stress factors that are related to it? Do you think we now live in a more higher stress environment that causes all that?
It's difficult to judge because, for example, I never lived in the other time era to be able to judge and say, okay, this era is much more stressful than the previous one. But at least what we can all agree on is that the level of physical activity has significantly dropped because we tend to do less. And again, the way in which we cope with stress nowadays is different, because nowadays you see a young man, oh, I'm stressed, let me smoke. Risk factor for hypertension and the rest. Oh, I'm stressed, let me go out with friends and take a drink. So you see the coping mechanisms are no longer the same compared to back in the day. Oh, I'm stressed, let me go to the farm and walk. So you see those changes in time frames or eras can play, but I can't really judge on 100% per se what it is.
Yeah, that makes a lot of sense. So I guess to fight some of this is really just to really be mindful of some of the things you talked about, which is, I guess, diet, the lifestyle, being more active.
Get checked more often.
Get checked. Managing stress in a more healthy way, that is not detrimental to our health. But beyond this, are there any other treatments that as doctors you would prescribe to people to take if they have been able to confirm their condition with a physician and all of that?
When you confirm your condition with a physician, the first key element of your management is health education. As a matter of fact, in a small association of physicians, not only Cameroon-based physicians who are also out, and we are trying to develop some group where we try to pass on educative messages like this one to people, because people need to understand what they're having as problems. Because when you understand what you have as problem, you can easily manage it. So we need to educate people on the harmful effects of toxic substances, but also when you're diagnosed with the condition, you need to adhere to your treatment. It's something which is never easy, because saying you have hypertension, it means you're practically saying it's a lifelong treatment, because most of the time, 95% of the time, is primary hypertension where there is no cure. All you're struggling to do is control the disease. And at that time, you need to adhere to treatment. And it's not easy for someone every day to take his treatment. So you need to educate, motivate, and make sure he comes regularly. Because if he understands why he is doing it, he will do it. But if he doesn't get why he is doing it, 1, 2, 3 months, but I'm taking those drugs, I'm feeling fine, so why continue? But the problem is when he stops, he'll come back a stroke, he'll come back heart failure, so those are the things. So not just education, but we need to give treatment. But the primary and the most important thing is making sure the patient is able to adhere to his treatment, adopt healthier lifestyles, and for the most part, when that is done, when that is achieved, the patient is going to have a longer lifespan, or at least have something else be the cause of a demise and not that particular problem in his case.
Yeah. Okay. Yeah, that makes a lot of sense from a technical standpoint. From the layman's perspective, I was expecting you to say that, we need, when we go around town, for example, we drive around Yaoundé, we need to have taxi drivers, learn go through some courses on anger management, and shout at passengers less and things like that. I'm sure, who knows, that may also be ways to reduce the stress that is going around the city.
Well, somehow. Yeah, that is one. But for that to be reduced, we too need to come to some understanding of the civic way of behaving. The civic way of behaving is, let's respect the traffic road signs, let's respect the highway code, let's respect this, let's respect that. Because when you respect those, there's little friction, little anger management problems that have to come up.
Yeah.
And we also need to learn to take things relatively. Not I will see you today, we may meet on the road, we have a small. Why waste time to be arguing and going through, whereas I may never see you again in my life, and I get angry, I get flared up, and something happens. So it's things that, as from a layman's perspective, we need to just learn how to take life relatively and take life as simply as possible.
Yeah. So yeah, Doctor, I think we have beyond all these illnesses, some of the respiratory and other conditions. I think we have an even bigger epidemic, a bigger problem that is more social, obviously, and I think it's us losing our doctors. We have great doctors like yourself who are committed to working here, but there are many more who leave. And it's not really just a Cameroon problem. It's a problem across Africa, in other countries like Nigeria, Cote d'Ivoire, Senegal. It's across West and Central Africa. And I think even beyond East Africa, it's it's prevalent all over. And I know you're all too familiar with this situation. So from your end, what do you think is the cause of this, and how can we fix it? Because obviously doctors are a really strong part of society that we should be making sure they stay here.
Thank you for this question, and like I've been saying all through, your questions are really pertinent and really hitting hard. But we would say, like every expert, the first thing is that I would start by saying I don't feel I myself am a great doctor. I just feel I'm a doctor, like all the doctors out there. But the second thing is that every expert likes to practice his art. A painter will want to paint and want to paint in the best conditions possible. A driver will like to drive in the best conditions possible on the best roads and everything. Same too with doctors. A doctor who is trained as a surgeon will want to express himself with the best tools available. So when you don't have the best tools available at your disposal on the ground, you tend to want to go where you'll find that best tool. And that comes to what we all know as the typical state, greener pastures. So everybody's looking for greener pastures, and you want to express yourself. You want to feel like, okay, I can practice medicine as it should be. So that's one element that we can't neglect. The other element that we can't neglect is people are going out because they think out there is better than what they have here in terms of remuneration. People are going out again because they think recognition is more. So there are so many diverse reasons as to why people move. Some people move also because of family. For example, you may be here, you have everything here, but you have a kid who has a condition that can't be managed here, whereas the expertise for it is the other side of the ocean, and so you find yourself moving there. So there are so many diverse reasons as to why people are moving, and there's no one size fits all. Each person or each group of people have their reasons why they move.
Yeah, that's very true. And yeah, thank you. But it's at the end of the day, it's still a situation that has to, some way be remedied. And from your perspective, what are some pull factors that you think can be put in place to make sure that people not only stay, but maybe even to attract those who have gone to come back, with the skills that they may have gained out there?
All right. There is also, when you repeated the question, I actually understood I didn't answer a part of it. But there is also the statement, like there's a statement, we are going to look for greener pastures. There's also the statement, there's no place as good as home. There's no place better than home. So people would like to or would prefer to be in their home place. So for example, someone who has the expertise and wants to practice that expertise, if that expertise or if the technical platform back home permits him to practice that expertise or to express himself, there's no reason why he should go. Yeah. Another person, if there is the health structure in such a way that the conditions that his kid will need to be managed out are present on site, there's no need to go. If the remuneration is better, there is no need to go. If so, there are so many conditions that play as to why people move, but those same conditions, the remedies are found in the reasons why the people move. For example, if we have a better healthcare system or healthcare structuring with affordable health issues, health management, and the rest, and also very well developed systems, you may see yourself asking yourself, why should I go? Whereas I can have the same thing in my country where I'll not be discriminated against, where I'll not be and if I'm paid well to be able to send my kids to school, be able to feel comfortable with whatever, not have to beg, or I can do all I need to do, I won't find myself living in another person's society. So the remedies are found in the reasons as to why people move. Improvement of the state of the art, things, equipment around, improvement in terms of working conditions, improvement in terms of affordable services being available, and I think that would sort out the issue. Some people also move because you finish your work and you're a doctor, and like you said, there are people who are needed, but you find yourself working in an environment where you didn't grow. For example, you grew up in, let's say, Yaoundé, Douala, Bamenda, that's the big towns in the country. But you find yourself, you finish, you can have a job as a doctor, a decent job as a doctor in Yaoundé, in Douala, but in the hinterlands, you can find something which is not really something, but you ask yourself, where do my kids go to school? So you see yourself asking those questions, and when you don't find any headway in here, you say, okay, let me try out, because maybe outside I'll find something. So all those things having to do with the person himself, personal choice. Secondly, having to do with the societal demands, and another thing having to do with the social construct of the country, with the policies that exist.
Yeah. It's a tough one, definitely. I think it's something that, with the right policies, some of the things you've talked about, putting in place the right infrastructure, better working conditions, better pay, and things like that. I think with the right policies, better equipment, yeah.
Because the hospital is not just the structure, but the technical know-how and the equipment on site.
Yeah. With the right policies and with some of those changes, I think we can be able to attract. But definitely, like every good politician would say, it would always take time. Like, it's looking at the current the status quo, it would take a while for that to be put in place. But I think if there's the will, if there's the political will, if there's the will of the people who are managing some of these systems, I think in a few years it can be done. But it needs a lot more of people saying, we want to do better, we want to stop losing the best minds that we have. We want to, because currently, I think, and this is the way that many people explain it, the government basically spends a lot of money subsidizing training for doctors, for medical professionals, but because paying 50K, in a state university is basically nothing, as a school, as tuition fees, compared to what other people have to pay out there. It's basically nothing. So the state subsidizes all that, but at the end of the day, when, the society has to benefit, then you see that it's, these skills are exported abroad.
Yeah, well, one of the things too has to do with planning. Because there is if you go to any country worldwide, there is a structuring, because there is some there's some addition or summing up of the effort. You ask yourself, you train how many people, and when you train the sole number of the X number of people, it's for what job market. So you have to make sure that there is some sort of equating or equations that are made so that what you send out as products meet a job market that is ready for them. So like you said, the policies that play or that come into play have to look at all those things. And I have the tendency of saying we must start somewhere. We must start somewhere. Even if it's baby steps, we must start somewhere. And I think the state, with the people that would think of ways to start somewhere. Like before, there was only one medical school. Now there's an explosion of medical schools in Cameroon. I think they're trying to produce more, but the problem is you produce more without having the job market for them. So there's still some sort of inadequacy which is created. So, but that's a step. The second step now will be to regulate how many come in, so that the people coming out are meeting a market, and the plan and the projections in 5 years, in 10 years, how many doctors do we need, how many will be going on retirement, so all that planning has to be in place. And also we have the tendency of saying the government has to employ. In no system in the world is the public sector the sole employer, because the private sector too has to do its part. And some of the best hospitals worldwide even are not even public hospitals; they are private institutions. So that also has its part to play. So we have the baby steps, as we say, but progressively we can reach there.
Definitely. Yeah, thank you, Doctor. But also moving beyond the medical field per se, as we know it, the westernized medical field, we also have, a lot of African traditional, practices, which we've had, a lot of herbs that, people mix up and drink and things like that. What are your thoughts on that? Do you think this is something that, can be valorized and can work alongside, the standard medical way of doing things? Or, do you think this is definitely knowledge that we should discard?
I would not say we should discard. I'll start by the last thing. I'm really not saying we should discard, because no knowledge is wasted. But now it's how we use the knowledge that we have that is quite important. Some of those herbs or some of those African traditional medicines are not bad per se, because some of them have value in it. But we need to study to know what in it is valuable, so that we can extract and have it in abundance, in quantities that meet the demand. Not just say, okay, we use this for this without any method, because we need to make sure that what people are taking is safe. So I come from, it's true, I'm still speaking some sort of scientific ways of thinking, but the most important thing for me is what the person is consuming. Can it help him, and is it safe? So we need to go from that premise. If we are able to make sure the people have something which is good and safe, fine. How do you make sure it is good? By getting into those traditional herbs, studying what they have, get the active ingredients out, and make sure they are safe for consumption. That's how I would see how we can make a blend, because I think that's what the Chinese do. They try to see how to blend their modern medicine with their traditional medicines, and we can be able to solve it. And so it passes by us not demonizing the African traditional herbs. But also, if we don't go through that route, we'll find ourselves where people are taking African traditional herbs for things which are not necessary, and they can cause trouble. I'll give an example. While I was doing my rotations in a nephrology unit, that's a service that deals with kidney problems, and you see someone come for kidney disease, renal failure, what we call kidney failure, and you'll be asking yourself, trying to find out. In the textbook, you said you need to look for this, you need to look for that, you need to look for that. You question and you will not see anything. But you ask the patient, oh, are you fond of taking African traditional medications? Yes. Repeatedly? Yes. By what route? I drink. Okay, it causes me to have diarrhea. It causes me to have... to the people, they are said, when you take this, you have this, you feel better. But unfortunately, it is causing adverse effects silently, and by the time they are coming to hospital, they already have. So the medications may be good. Some are bad. But how do you cut across to find the middle ground is by accepting to know what is in it, test it, and because no matter what we say, medications were discovered from natural derivatives.
That's a lot. Yeah. Thank you very much, Dr. Kuaban. It was really great having you and having these discussions about the medical field and all the diseases and illnesses of your specialties, how we can prevent them, and even a little bit about African traditional medicine and how we can valorize that. Thank you very much for your time.
No, the pleasure is mine, and really, really, really honored to be here. And hopefully it's just the first, so that we can continue educating our populations on what is available, what is out here, so that people can have healthier lifestyles. And you'll sound bizarre. The less people I see in hospital, the better I feel, because it means I have less patients who are sick, and the population is well, meaning we can grow the economy. And that is something really, really, really good to us. Really, it's an honor. And I'm not just coming here on my person as Dr. Kuaban. Really, doctors have put themselves into associations that are more inclined to preventive medicine rather than the classical diagnosis, treating, so that people can be. And that's why I'm part of an association which is coming up with the idea of being much more invested in preventive medicine.
That's great. And looking forward to having more conversations, not only on pulmonology.
It's really tough call. Not only on lung problems.
Not only on lung problems, but on a lot of other health issues that are plaguing our society. And there are definitely quite many. So thank you again, and looking forward to talking next time.
Thank you. My pleasure.